Hi there, I'm Kim Sedgwick.
And I'm Amy Sedgwick of Red Tent Sisters.
And ecosex.ca. If you've watched some of our other videos, you might have heard us talk about the Justisse method. And so a lot of people have asked, what exactly is it? So that's what we thought we would talk about today. So Ames, why don't you get us started?
Yeah, absolutely. So the Justisse method of fertility management is an approach to fertility awareness that looks at women's physiological changes and day-to-day signs of fertility so that a woman can track her menstrual cycle extremely accurately and identify exactly which days she is capable of getting pregnant. So we actually only ovulate on 1 day per cycle, and that egg is only viable for about 1 day. So there's actually only 1 day per cycle when we can actually get pregnant.
Can I just point out that that's a big deal? Because I feel like most people do not know that, myself included.
Yeah. So the reason that we have more fertility than that is because with the right conditions, i.e. when a woman has like stretchy egg white cervical mucus, male sperm can live in a woman's body for 3 to 5 days. So it's really important to be able to determine that kind of combined fertility, not just the day that we're actually capable of getting pregnant, but the days when we can actually support the survival of sperm. So fertility awareness looks at those signs of cervical mucus production. So, you know, what you see when you look in your underwear or when you go to the washroom, when you wipe, when you're going to the bathroom. And it helps us to determine exactly which days we are capable of supporting the survival of those sperm. So the Justisse method is an approach to tracking the cervical mucus as well as our basal body temperature. So that's another piece that we look at because it tells us when we've ovulated. It can help to confirm ovulation and tell us when to be expecting our period. So when we combine those two pieces of information and occasionally also a third piece of information, which is the position of the cervix, we can get a really detailed understanding of exactly which days we're fertile. And then once we know that, we can make really educated choices about what we do around our contraception. So women who use this method for birth control might choose to abstain on those fertile days, in which case the method is over 99% effective for avoiding pregnancy, which is amazing. Sometimes people will choose to use another form of birth control on those days. So it might be a condom or a cervical cap, withdrawal, a combination of those things. And so you can use it in that way for birth control. You can also use it to get pregnant by identifying exactly which days you're fertile and which days are best for trying. And then lastly, you can also use it to actually identify hormonal imbalances and health issues so that you can work with holistic practitioners to stabilize your hormones and get back to, you know, a healthy cycle. And so for those reasons, I really feel like it's the kind of skill that every woman should have across her lifetime so that she can monitor changes in her health. She can monitor her move into perimenopause. She can use it to get pregnant, not get pregnant. It's just the kind of information that I believe every woman should understand about her body, regardless of how she's going to use it. And it works so well in combination with other methods of birth control, like condoms. So, for example, if a condom breaks, then you know whether or not there's a risk of you actually getting pregnant at that time, and you can make decisions around emergency contraception and, you know, those other kinds of choices that you might need to make. So.
And I just want to quickly ask, because I know a lot of people get confused about fertility awareness and the rhythm method. So can you briefly just explain the difference between those two?
Absolutely. So fertility awareness looks at our day-to-day signs of fertility. So it's based on what I see in my body today. Based on that, am I fertile or not? Whereas the rhythm method is really just about assuming that women have a 28-day cycle and kind of blanketly abstaining during the days when it's expected that a woman will ovulate. The problem being that there are lots of reasons why women don't have 28-day cycles. Some of it is hormonal, some of it is, you know, stress or illness or traveling. It can be any number of issues that will change the length of our cycle. And so the rhythm method doesn't take that into consideration. And because of that, it's not very effective.
Exactly. So very different, the two methods.
Very different.
Yeah. Cool. So if you want more information, we've got a few things on our website. We have a Ditch the Pill report that you wrote.
Yes.
And we also have a 25-minute video that explains the Justisse method in more detail. So you definitely want to go check those out.
Yeah, that can be found at ecocontraception.com. And that gives also information about my particular approach to teaching the Justisse method and how you can go about learning it.
Cool. If you've got a question, make sure to write the sisters at redtentsisters.com. You can also find us on Facebook and Twitter, and make sure to sign up for our newsletter to find out more about what's happening in the sisterhood.
That's right.
Thanks so much. Have a great day.
All right. Take care. Bye-bye.
Bye.